Down syndrome, also known as trisomy 21, is one of the most common chromosome abnormalities in humans. Down syndrome was named after the British doctor that fully described the syndrome in 1866, John Langdon Down. It's a genetic disorder typically associated with physical growth delays, characteristic facial features, and varying degrees of intellectual disability. Subscribe for more cool facts. Down syndrome occurs in approximately 1 in 1,000 births each year. The parents of a Down syndrome child usually have no genetic abnormalities. The extra chromosome occurs purely by chance. The chance of Down syndrome is increased as the mother's age increases, but there is no known behavioral or environmental factor that alters the possibility of occurrence. The most common cause of the disorder is an extra copy of chromosome 21. Other common mechanisms that can cause Down syndrome include Robertsonian translocation, isochromosome, or ring chromosome. Education and care improve the quality of life for children with Down syndrome. Approximately 20% of adults with the genetic abnormality can hold gainful employment. However, many of these individuals require a sheltered work environment and assistance with financial matters. Typically, the life expectancy of an affected individual is around 50 to 60 years in more developed countries. Individuals with Down syndrome exhibit both physical and intellectual disabilities. Slow to develop, adults typically function at levels like an 8 or 9-year-old child. Because these individuals are slow to develop, they are typically shorter in stature. Down syndrome has specific effects on individuals with the disorder. There is an increased risk for several health problems, including, but not limited to, a weakened immune system, congenital heart defects, epilepsy, leukemia, thyroid disorders, obstructive sleep apnea, obesity. Physical characteristics of individuals with Down syndrome include small chin, slanted eyes, poor muscle tone, flattened nasal bridge, protruding tongue, flat, wide face, short neck, excessive joint flexibility, short fingers with abnormal fingerprints. Down syndrome also affects the senses and fertility of affected individuals. Hearing and vision disorders occur in more than 50% of people with Down syndrome. These problems also tend to worsen with age. Males with Down syndrome usually do not father children, and females have a lower fertility rate. Menopause usually occurs at an early age in females with Down syndrome. Screening for Down syndrome is recommended to all pregnant women, regardless of age and variety of tests, with varying degrees of accuracy are used. Since no single test is definitive, a combination of tests is used to increase detection rates. Blood tests are used to measure markers that can predict the risk of Down syndrome within the first or second trimester of pregnancy. Ultrasounds are also used for screening during 14 to 24 weeks of gestation. Because there is no cure or medication for Down syndrome, the most common treatment for individuals is health and mental management. Health screenings for specific diseases are recommended on a systematic schedule. To enhance cognitive development of individuals with Down syndrome, speech and language therapies are used along with early education programs. Individuals with Down syndrome are at higher risk for premature death. This is mostly due to heart problems or infections. However, improved medical care has increased the life expectancy. Approximately 4 to 12% of affected individuals die within the first year of life. Subscribe for more cool facts. Have you seen our video on generalized anxiety disorder? Check it out. Lots of people struggle with it, but understanding it goes a long way at improving the quality of life of people with GAD. Thank you so much for watching. See you soon.